morning, everybody, and thank you for joining us today. It was just a couple weeks ago when I stood at the Iroquois Amphitheater addressing the graduates of Louisville Metro Police Department Class 48. And one of the things that I told them and their families that this is a day in our city, in our country, to reimagine public safety in a way that will better protect and better serve the people of our city in new and improved ways for community trust and community legitimacy, but also in ways that would make it easier for the police to do their jobs more effectively. Because we've talked about quite a bit here in our city and again all around the country that for some reason we have looked at our police as the vehicle to deal with all of society's problems, and they're supposed to be able to stand up and address them all. And so we've often failed to effectively deal with a lot of challenges, including working and helping people who have behavioral health issues in ways that keep them out of the legal system, in ways that have not benefited them, or ways that have not been designed or meant to help with the treatment that they require. So that obviously is not so smart, right? And the dumbest thing would be to keep doing it over and over again and accept a different outcome. And it's not fair to the people that are in need of assistance. It's not fair to the people. It's not fair to all the folks that are involved in these crises that need something different and need something more than a police officer showing up. I also reiterated to that graduating class of new LMPD officers that public safety is the #1 priority that we have as public servants, and creating a safe city obviously is too big a job for any one agency, any one police officer, any one mental health respondent, any one citizen. And it's something that we all have to work together to create here in our city and around the country. And when we talk about a whole of government response, we mean all of metro government, state government, federal government. When we talk about whole of city, we just don't mean every citizen here, but every citizen of the Commonwealth and the country. So we're here today to announce our next step in that reimagining. It's a deflection model that deflects away from criminalizing or not giving proper assistance to mental health issues and towards putting the right resources in the right place at the right time. So thanks to an innovative pilot program developed with the help and guidance of several experts, our first responders in LMPD's 4th Division will be assisted by a new alternative response model. And this model consists of people who are trained for human emergencies that also are part of public safety, but not necessarily law enforcement. So in this program, 911 will deflect some of its calls and callers to non-police responders focused on problem solving and de-escalation. These community responders will evaluate the needs of these callers by phone and assess if further intervention is needed in which community service might best help the caller. This next step for Louisville's public safety reflects not only what we call reimagining public safety, but it also represents a very material $5 million investment in the budget that was passed this July 1st as part of our deflection and diversion programs. And those programs make up just part of the quadrupling of our city's investments in violent prevention efforts, again, that's manifested in this last budget of July the 1st. With these investments and priorities, we're acting on our shared goal of creating a safe city with fewer arrests and less incarceration for those who qualify for alternative programs, which I hope everybody can agree are admirable and achievable goals. We've got a lot of partners that put this together. There's a growing body of evidence around the country around these type of programs, but it's still not mature because a lot of these programs don't have years and years underneath of them throughout America. So it wasn't as easy as just going to one place and say, okay, they've been doing this and they've been doing this for decades and decades and here's what works. So I'm really grateful to our partners that have helped put together this recommendation. The partners include the University of Louisville's Commonwealth Institute of Kentucky, Kentucky's Department of Behavioral Health, Developmental and Intellectual Disabilities, 7 County Services, Spalding University School of Social Work, and community members tapped as alternative responders known as DOVE delegates, D-O-V-E. And DOVE stands for Diversion, Options, Voice, and Empowerment. I'd like to acknowledge Dr. Shannon Cambron, chair of the Spalding University School of Social Work, who is with us today. And we're now going to hear from a few of the representatives and others. So first up is Dr. Susan Bacino with the University of Louisville. I want to also thank Dr. Craig Blakely, the Dean's U of L School of Public Health, and Susan Bacino is going to be speaking on behalf of U of L.
Mayor Fisher, Metro Council members, emergency response teams, and Louisville community members. Thank you for entrusting us with this important work. Our team of transdisciplinary researchers has dedicated hours of work and infinite passion over a very short time period to develop recommendations for an alternative responder model that meets the unique needs of our hometown. We appreciate your time today to hear about our findings and recommendations. I would like to recognize the members of our team, which was supported by the Commonwealth Institute of Kentucky in the U of L School of Public Health and Information Sciences, 7 County Services, the Spalding University School of Social Work, the Kentucky Department of Behavioral Health, Developmental and Intellectual Disabilities, and Louisville community members who have been so invested in changing how we define community safety. In the past 3 months, we were additionally joined by representatives of the emergency response system to help think through the logistics of programming. Jointly, we have identified as DOVE delegates, comprised of a steering committee, operations committee, and community accountability board. Throughout this study, we have been intentional about collecting input from Louisvillians, both those who serve and those who need services. We conducted interviews and focus groups, we went on police ride-alongs, and we observed in the MetroSafe 911 call center. Our project manager, Kalila Collins, who can't be here today, invited conversations with anyone who would talk to her. We asked about what the community needs, what the community has, and what creative solutions and crisis responses are already in action. One of the themes that arose in our research was the varying definitions of community safety. Broadly, community safety implies that people are thriving and living their best lives, with freedom from fear, without violence, and without the threat of violence. Violence is preventable, but imposing structural violence to prevent interpersonal violence is not safety. Community residents have made it very clear that safety is the availability of needed resources and support. Safety comes in the form of housing, healthcare, living wages, and food security, when your basic needs are met and you have the resources you need to solve a problem. I mention this because prevention requires that we address the root causes of crisis and not simply react to them in the moment. Public health research tells us that an equitably resourced community is a healthy and safe community. We cannot be naive and think that we will solve this problem immediately, that the solution is simple, or that we can implement another community's model without considering the uniqueness of our own city. In addition to an extensive review of the work occurring in other cities, we investigated the context of Louisville deeply. We considered prior local pilot programs with similar goals that have started but stopped short, and looked for the lessons that we could take from those. We considered the state of the relationship between the community and local institutions, and how imbalances in power create distrust in the systems that control the resources. And we analyzed 911 call data so that we could determine the trends in geography, time, and call types. This included analysis of call narratives to understand where it made sense to begin a new program. Specifically, we focused on CIT calls, which indicate issues related to self-harm, intoxication, or someone otherwise experiencing a behavioral health crisis. Based on this work, we recommend a multi-layered model for Louisville to include public and private partners that operate synchronously as a system of care, connecting people in crisis to the resources that they need to feel and be safe. In the model, we envision a behavioral health hub within the MetroSafe 911 call center. When a call is made to 911 and identified as potentially appropriate for a DOVE delegate's response, call center staff will transfer the call to the behavioral health hub for further triage. The behavioral health hub triage worker will consider the situation, the needs of the caller, responder availability, and risks, and may be able to de-escalate the crisis during the conversation, but also has the option to connect the caller to a crisis hotline for further conversation or connect them directly with services. If the crisis warrants an on-site response, the Behavioral Health Hub can request dispatch of the DOVE delegate's mobile response team, which will consist of 2 individuals trained in crisis intervention to rapidly respond, effectively screen, and assist persons in crisis in accessing the appropriate level of care. In situations that present as higher risk, but also provide evidence that the situation will likely not escalate into a safety concern for responders, the Behavioral Health Hub can coordinate with call center dispatch to deploy LMPD and DOVE delegates' mobile response team simultaneously. We learned that the strength of these models in other cities has been their evolution, and we received advice from other programs to start small. And therefore, in its initial phase, the pilot of the DOVE Delegates program will operate in LMPD's 4th Division and will focus on CIT 911 calls only. The 4th Division was chosen due to the volume of CIT events and variation in community and business locations. The first phase of implementation will operate in 2 8-hour shifts, covering 10 a.m. to 2 a.m. to align with the busiest call times. We have outlined a phased implementation plan in our report, but the evolution of the program will depend on community feedback, and growth will follow what we learn in each phase. Ultimately, the DOVE delegates model will have a no wrong door approach so that individuals in crisis across the city can access assistance and the connection to resources through multiple channels, and not only 911. It will also expand to a network of providers so that individuals can be matched with the empathy and care that they need in that moment. As multiple prior initiatives have demonstrated, new programs need time for evaluation and refinement, and it's important to note that the program will require consistent funding, even in anticipation of any growing pains. Again, I want to thank you for this opportunity to serve our community. We are excited to begin a new implementation phase and expand upon the emergency services that are offered currently. We are determined to get this right and build a system that redefines community safety in Louisville.
Thank you, Dr. Bacino. Obviously, mental health support and services are integral to this whole program, so it's essential we are working with one of our region's leading providers of mental health services, and that, of course, is 7 County Services. And speaking on behalf of them right now is David Weatherby, their Chief Operating Officer.
On behalf of the Board of Directors of 7 Counties and the whole team of 7 Counties, we're very excited to be here today. We're excited to share this information and this report and the recommendations that we have going forward. We're pleased to have been a part of the DOVE Delegates Project for the last 7 months and have partnered with Louisville Metro, the University of Louisville, Spalding University, Department for Behavioral Health and Intellectual Disabilities, and many other community partners to do this work. We look forward to the opportunity of being a service partner as we move forward with this deflection pilot. This pilot project at its very core is what 7 County Services is here to do in this community. Each and every day we send out dedicated teams to work to help our community members and our loved ones to find the hope and the healing that they need. 7 County Services has provided community behavioral health services and crisis services for over 45 years in this community, and we're well situated for this project. We believe that early intervention in times of crisis and the connection with needed supports will result in lower hospitalizations, lower incarcerations, and better community outcomes. We know that this work is only the beginning, but we are committed to creating a safer and more equitable Louisville. It is our hope and intent as this project goes to scale and moves across Jefferson County that we will partner with other community agencies and organizations to do this important work.
Thank you, David. As Dr. Buccino noted, the 4th Division of LMPD is going to be the initial pilot area for this project. I'd like to recognize Major Tiffany Tatum, who leads us in the 4th Division, for being here. I want to thank her for all the good work that she's doing there, and the entire 4th Division team and all of our LMPD officers. And I would like to introduce a member of LMPD that's given many years to her career with LMPD, and that's Sergeant Pam Oberhausen. She's LMPD's Crisis Intervention Team Coordinator, and if you know anything about LMPD, you know the high respect that Sergeant Oberhausen is held by many, many, many people, so we appreciate that. Sergeant?
Thank you all. I appreciate you all, the opportunity to be here. As the mayor stated, I am the Crisis Intervention Team Coordinator for Louisville Metro Police Department, but I am also a patrol sergeant in the 4th Division. So it only makes sense that this would start in the 4th Division, where the most active and most runs come out, calls for service in general, as well as CIT runs. Crisis Intervention Team, many people get confused. We've been around since 2001. The T in team is a three-legged stool. It's just not CIT officers. We're just one part of that three-legged stool. We have mental health professionals, and as well as advocacy and consumer groups. And that makes up the team, the T in team. And that is why Louisville Metro has one of the most successful CIT programs in the United States, is because we have a fantastic team. All of the people that were already mentioned, 7 counties, NAMI, Bridgehaven, University of Louisville Hospital, all the hospitals, we have a great relationship. That's why the ultimate goal of this, and the way that everyone looks at it is how can we help the most kind of flushed aside people in society, our mentally ill people. How can we help them as best as we can? CIT does great work. The officers do fantastic work, and that will not change. We will still respond. We do not mind talking to people in crisis. But this program, with the Dove advocates and Dove responders that are going to be in collaboration with us, it's only going to help our mentally ill people, our people that have kind of been shunned in society. And that is ultimately the goal that we are looking for, is to help people. And that's what I believe that this program will absolutely do and be successful at doing, is giving people resources that they never had before, getting people help they need right when they need it, as opposed to not being able to do that and have that accessible to them.
Thank you, Sarge. In closing here, before we take questions, I want to recognize some folks here today. First, I want to thank the Metro Council for this work on their effort. Obviously, this has been a collaborative process that led up to the passing of the budget on July the 1st. Metro Council President David James is here, so thank you, President James, for the good work on all this coming together. I know our community's been looking forward to this for quite some time. Council members Hollander, George, and Fox were particularly involved with this effort, so they couldn't make it this morning, but a shout out to them as well. There's a lot of folks from Metro government that are here right now that shows kind of how much attention has been put on this, so I'm going to try to recognize some of you all. I'm probably going to forget some folks, but our Deputy Mayor, Ellen Hessen, is here, who's been strong on this project for quite some time. Our Chief for Public Safety, Matt Golden, as well. Thank you for your good work. Monique Williams, our Director of the Office for Safe and Healthy Neighborhoods, is here. Our Corrections Director, Dwayne Clark, is here. Our Fire Chief, Greg Frederick, is here. Our EMA Director, Jody Myman, is here. Assistant Director, Kelly Jones. Chief Shields, and I'm sorry, I probably left somebody out. But you can see how much we've been focusing on this whole of government approach toward this area from the highest levels of Metro government. So we're hopeful that we're going to see some significant progress here, and certainly the people that we're trying to help deserve that treatment and much, much more. With that, we're happy to take any questions.
Thank you, Jody Myman, Executive Director for Louisville Metro Emergency Services and also over the Metro Safe 911 Center. So a 911 call is going to come in, and our call takers will be trained to triage that call, and there'll be a flow chart that they have to go through, and then once they meet the criteria to go to the behavioral health specialists that are in the hub, they can send that call over to them, and it's kind of twofold. Once they get it as well, they'll do additional triaging on that call, and then they could potentially even send it back if they determine that there is a safety issue that they need a police response or a co-response as well. So if they feel like they can take that call and they can send it and divert it to some other help for the people that are involved, then they'll do it that way. There'll be a key set of questions that are asked first. That do you have a weapon? Are you trying to harm someone or yourself? Just those first couple questions are going to set the stage on where that call needs to go. We're going to take a look at the recommendations and obviously look forward to working with the team that put it together. They're going to have to work with some of the behavioral health experts, but it's going to be some internal training that we're going to be doing. We're looking at best practices across the country. We've already made some good contacts with some cities that are having some very successful outcomes with programs such as these. So we've got a lot of help that we can go through and ask other, again, subject matter experts. We're not really using a specific one. We've looked at Austin, we've looked at Albuquerque, we've looked at Houston, and there's some other ones as well across the country that we've made some smaller contacts with.
So we put together a comprehensive chart of models across the country and what they were doing and what kinds of responses. And so, as I noted earlier, it was really important to us to match other models and components of other models with the needs of our city. We recognize that our city context is very different from that of others, even in very successful programs across the country. Some of, the most well-known is Cahoots in Eugene, Oregon, but it's been around for 30 years, and so it's really evolved. So what we decided was that we needed a combination of that call diversion model, because some models simply answer the phone, pass that off to that triage for more information, and really act as a crisis hotline, rather than a full model of on-site response. We'll have the Dove Delegates Mobile Response Team is a community responder model. So it's not people who are typically in their emergency response system, but go through and work with the emergency response system to respond to an emergency. And then we're also implementing that co-responder model so that if there is something that is defined as higher risk, that LMPD can be present to assist with any safety concerns before facilitating an introduction to the Dove Delegates team on site. So I hope that helps. So we are looking at trained crisis interventionists, and that's their primary qualification. What we really hope for is that our responders in the field have lived experiences of the community. So whether that is peer-specific in a way that's aligned with a behavioral health peer support model, or lived experiences in the community that they're serving in a specific division. We know that the culture of Louisville varies across police divisions, and so we want to make sure that as we expand and grow, that we're really meeting the needs of the entire community, because it's not necessarily a one-size-fits-all. We have position descriptions ready to go, and I'll let 7 counties speak to whether or not they've been posted for application. But we're aiming for a December 1st start date. As you know, nationally and locally, the economic situation kind of dictates how we staff things and how quickly we can get things up and running. So that's our goal, but we also recognize that there may be challenges to meeting that goal. So we looked at all of the police calls for the last all of the 911 calls for the last 2 years. So June of 2019 through May of 2021. And in total, the CIT calls reflected 4.3% of all LMPD created events, which equated to about 40,470 events in those 2 years. And that's an average of 56 CIT calls a day. The 4th Division had 20% of those calls. So of that 40,470, 29,000 would be immediately CIT eligible based on the criteria, or Dove delegate eligible based on the criteria we have listed. Now, it's really important to note as well that what we observed was that the call takers only have the information that the caller gives them. And so they can ask questions, but there's a lot of information that may not align with what responders find on site. So we have to look at the call narrative, and we don't have the full picture in that, but we could immediately sort out different terminology that created categories where we could think about what eligibility criteria for deflection. And so then the other calls, those remaining 11,000 calls, were a little bit higher risk, and those may potentially fall within that co-responder model. There are some calls that are legitimately something that LMPD and safety need to take care of, that it's not appropriate to send community responders to that scene. And so we're aware of that. We're also aware of how community responders can then connect with more resources and additional emergency responders should they need backup and assistance if the situation isn't safe.
Okay, so I want to thank everybody for coming out. I do want to recognize Anna Lee Taylor over here. She's my general counsel. She's been involved with this project quite a bit, as Wanda Mitchell-Smith is also with our liaison for the Metro Council. So thank you all. Again, in recap, this is one program of the entire Reimagining Public Safety budget that was passed here July 1st, but it's been a long anticipated and very important one. On all these programs, we have to, have some constancy of effort with them. And there's going to be hiccups. There always are. The key is that we got to work through those hiccups. We got to at least have, several years to make sure we know what works and what doesn't work. But the worst thing you want to do is just start something and finish it in 6 months and just say it didn't work. So these things are complicated and require time. And so we're pioneering a lot of this stuff here in our city and look forward to good results. So thanks everybody for coming out today.